everybody. This is Sue Ann Jackson from the State Unit on Aging. I want to welcome you all to the continuing series of webinars for 2016 that the SUA presents once a month. This one is particularly geared for any ADRC community partners and AAAs who want to do outreach and work with their local tribes, and specifically this one is geared toward working on your area plan and how to get those folks involved. We will be recording this webinar today. We are actually recording now, and we hope that it'll be posted by next week. We will have to close caption it and then get it posted with the PowerPoint. So the title for today's webinar is Title 3, Title 6, Coordination, Understanding the Approach, Recognizing the Need, Partnerships in Indian Country. We're going to keep everybody muted like we usually do to avoid feedback and background noise. Please text chat your questions, and that is my whole job. I'm sitting here looking for your questions, and I'll be watching for them, and I will be interrupting Shelley as I can to ask the questions. If you're a group site, please text chat or email me a list of those that are attending at your site. We did send out the PowerPoint yesterday to people. If any of you registered after they got sent out and didn't get one, just shoot an email to Lori, Lori.c.watt, W-A-T-T, @state.or.us, and in the subject line just say webinar materials please, and she'll shoot you the webinar materials. Want to make sure that you watch for an email within the hour after the webinar is over. There will be a SurveyMonkey link, and we ask for you to fill that out. It's very short and sweet, but it's a good evaluation for us to know how we did and how the webinar was for you today. So I want to thank you all for being here, and at this time I want to introduce Shelley. Is it Zylstra?
Sure is.
Great. Who is our Region 10 Aging Services Program Specialist with the Administration on Community Living. She does have a background in Area Agency on Aging in Washington State for many, many years, and I'm going to ask Shelley to just take over and talk to you about.
Thanks
We're
so
really
very
excited
much.
to have you here, Shelley. Thanks for being here today.
It's really good to be here, and I kind of feel like I'm back with old friends. So many of the people in Oregon I've worked with for many years, and it's just really exciting to kind of be back and be working there again. When I was asked to talk about this particular issue, I think probably it had to do with the fact that in the area agency that I was working with for nearly 30 years, I think it was about 27, 28 years, we had really good relationships with the 6 tribal communities in our region and worked well with them in a variety of topics. So I'd like to share kind of what I have learned and some good reasons, and then give us some healthy time for discussion about issues. Overview for today, we're just going to kind of introduce the issue, talk about a little history about why this can be difficult, talk about what the actual Older Americans Act says, look at a cultural approach to services and to contract development, give you some ideas of some successful models for working with tribal communities, and then talk about a gift in lean times. We discovered in our area agency that so often it was the tribal connection that helped us to land a bunch of different grants, and so that was very helpful to keep staff employed for the time. Working with tribal communities can be challenging, and some of you have probably tried and failed, or some of you may have been very successful in your working. The barriers are huge. There's many of them. Jurisdictional barriers. Can I go on the res? Can I do monitoring on the res? Geographical challenges. A lot of the lands that the tribes have are pretty isolated. And so getting to them is a barrier. It means a full day on the road. Directional, and what I mean by that is sometimes we walk through doors straight on and they walk through sideways. And so the approach to working in services and approaching things can sometimes be a cause for misunderstanding. So keeping the communication lines open, I think, becomes very, very important. And then there's the cultural barriers. And, you know, we are coming from 2 different perspectives. And the cultures vary. We'll talk a little bit about that. But those can cause problems and cause for unintended misunderstandings, I think, for communities as well as for service providers. But I think overcoming these barriers and these issues are things that we have to do if we're going to meet the mandate, and frankly, just to do the right thing. When I looked at the Oregon statistics, and these are fresh out of the hopper for the ones that were provided this year, it said that about 1.8%, actually these are census statistics, about 1.8% of Oregon's older adults are Native elders. The map shows, and this is not elders, this is actually percentage of Native Americans by county in Oregon. So you can see where there's the darker the square, the more percentage, or the higher the percentage. Your 2014 state data indicated that while 1.8% are elders and Indian elders in Oregon, 1.4% of your congregate participants were tribal elders, 1.1% of your home delivered were elders, and when you looked at all registered clients, about 1.2%. So you're not seriously underserving, but you are underserving this population. So maybe there's some things we can do to work on that. When you look at American Indian elders from a sociodemographic perspective, and these data came from socialsecurity.gov, and the ASA is the aging organization, American Society on Aging. We know that 22% of Alaska Natives and American Indians live on reservations. And the reason I think that's important to understand is that it means that, Multnomah County is not off the hook because they have a large percentage of their population who are Native American who live there. So 88% of elders or people who live, Native Americans live off reservations, so don't think they are only there. When you look at the target populations for the Older Americans Act, you see low-income ethnic minority, frail, poor health. There's some they allude to Alzheimer's disease and other dementias, and then the rural and isolated are also some target populations. And let's take a peek. The chart there gives you a look at what are the characteristics, and then the first column is American Indian, Alaska Native, and then the total population. So that would be the total population including American Indian, Alaska Natives. If you compare this to white only, the numbers are dramatically different and frankly dramatically worse. But home ownership, and we know as aging specialists that home ownership is really very helpful when you look at the economic abilities of older adults to be successful. Rent goes up much faster often than does income. And so a person who does not own their own home is at a disadvantage. And we see that 48% compared to 64% in the total population. Individuals who are living at or below 100% poverty, and those numbers, as you're well aware, are very, very low. 20% of American Indians are living below poverty, elders again, and the total population looks at about 12%. Life expectancy, and this one is one if you were born today. If you were born today and you were an American Indian, you could expect to live 73 years. Right now, the male-female combination life expectancy is 78 years for the total population. Individuals who report fair or poor health, and we know in the literature that these are very good indicators of what actual health is. Self-understood or self-reported health can be a really good measurement, and we know that American Indians report, 46% of them report that they are in fair or poor health, and the total population, same question, 34%. Disability rates are higher in Indian country. Median income is substantially lower than in Indian country, roughly half. And those numbers that you have on your slides, I realize were reversed. When you look at grandparents raising grandkids, which is, of course, a population focus for our caregiver programs, you see that American Indians, about 4.26% of them are raising kids that are not their own by birth. And in the majority population, or the total population, that number is 1%. So there's the target characteristics sort of in a nutshell for this population. We know that medical care is a treaty right. When the tribes negotiated treaties with the U.S. government, they included things like education, food, religious practice, and health care. And the unfortunate part about Indian health care is that as the Older Americans Act sits on the discretionary side of the budget, so does the Indian Health Service. And the Indian Health Service has dealt with inflation about as well as the Older Americans Act has, and we know how that has not kept up with inflation, nor the
Shelley?
Yeah.
We just have a question on the last slide. Sorry,
Yep.
I just got to it. Is this data for older adults or for adults of all ages? Is it just older adults or is it
Those
everybody?
are just older adults.
Yeah.
Yep. And now I am going to try to go back. There we go. Yeah, these numbers are just for older adults.
Thanks.
Yep. Well, let me take that back. With the exception of the question about life expectancy, obviously that's for somebody who was born today. Health status with regard to Indian elders is amazingly different. These are actually rates per 100,000, which is usually how these statistics are reported. And their heart disease rate is somewhat lower, and their cancer rate is somewhat lower, probably due to the life expectancy change. But when you look at injury rates falling down, 94.5 rate compared to 39 for the total population. When you look at diabetes rates, 61 out of 100,000 compared to 20, those are reversed too, 22, no, that's right, 61 compared to 22 out of the 100,000, so those are okay. Liver disease, huge problem related to living conditions, environmental conditions, alcohol intake. These are all things that are affected there. Flu and pneumonia, they're more likely to have flu and pneumonia. And then I put in youth suicide. And the reason I included youth suicide is the suicide rate amongst Indian youth, particularly young men in Indian country, is off the charts. And this, because of the family unit being extended in Indian country, profoundly affects the elders. And so I just put that in because it's really food for thought with regard to what these folks are dealing with. I think it's important to have a little bit of a history lesson. We all took U.S. history in high school and middle school, but I think there were some things that were maybe missed out, and this kind of lays the groundwork for why there can be some difficulty in communicating back and forth between us. The first thing there, the Columbian Exchange, was actually, it's a term used when you talk about what Christopher Columbus brought to the New World, and it was all types of illnesses which were not, to which the Indians had no immune response at all. And so the population was decimated. They estimate, they don't know for sure because there weren't written things, they weren't writing things down at that point, but they estimate that about 90% of the total population of the Americas died because of the Columbian Exchange. In 1778, we started our first push towards getting the Indians to leave, and the Continental Congress said, okay, Indians have to stay west of the Appalachians. And in 1830, we had what we called the Indian Removal Act because we had more folks here and they wanted good farmland. And this was particularly directed at what they call the five civilized tribes, or the Seminoles, Choctaws, Cherokees in the southeastern United States, and they were told they had to move west of the Mississippi, and they were moved onto the Indian territories through a process called the Trail of Tears, which you may have heard about, where they were just told to get up and walk, leaving their homes behind them. The first boarding school, the tribes actually negotiated for education opportunities, and so in order to meet that requirement, the United States government decided they were going to start having the compulsory boarding schools, and the first one opened in 1880. We'll talk a little bit about that here in a minute. Both the Dawes and the Curtis Act took away land from the communities and started to move them towards reservations. And so in 1830, we started seeing reservations, and they progressively got larger or got more of them in the following years. In 1924, Indians became citizens, and that was landmark because it allowed them to actually leave the reservations lawfully. And they did all get the vote in 1965, so that was a surprise to me that folks in many states could not vote until 1965. There was a Reorganization Act that came about in 1934 under the Roosevelt administration, and there was a lot of work done there to restore tribal governments. Emphasis was placed on culture, religion. You'll see in even in mainstream America at that point, there was a real focus on all things Indian, and there's a lot of Indian influence in art and a lot of the cultural things that were happening in the white or the majority community at that time. But in 1952, we had a different president, and he began the Relocation Act. And what that did was it encouraged Indians to move off of the reservations into towns so that they could be moved into large communities like Los Angeles. And there were metropolitan areas all over the United States where people were encouraged to go to find work. In 1953, the same president established, under his jurisdiction, was the Termination Act. And what the Termination Act did was it effectively canceled all federal programs for tribal communities. And so they were just stopped. The feeding programs were stopped. Medical programs were stopped. And they weren't fully reinstated until 1975. And so there was a 20-plus year period where there were no services in the reservation. The reason this history lesson is important because we are dealing right now with people who were young adults in this period of time and are suffering the results of not having good dental care because the programs were disappeared, not having an education, not having access to good food and other health care. The boarding schools, I think, is one that, for me, probably opened my eyes to Indian country more than anything. And compulsory education for tribal children began somewhere between 1880 and 1883. The highest enrollments in the boarding schools were actually in the 1970s. But it's interesting that children were actually rounded up. I think you've all been to the circus or to the fair where they have if you're taller than this, you can get on this ride. They have a measuring stick. Well, there was a gentleman who would come around, and this was from an elder who this was picked up in this way. He had a stick, and if you were taller than the stick, you were given a mason jar full of water and a half a sandwich and put in the back of a cattle truck and hauled away. There was no communication with parental units. There was no discussion with anybody in the community. The kids were just rounded up and hauled off. They were sent at about age 5, and they were returned to their communities when they were 18. They didn't get to come home for Christmas or get home to come home for summer. And again, this is a general statement. Some people did get to come home because they were in ones that were close by, but often the choice was to send the tribal community members to distant places because otherwise they would just leave and walk home. They were not allowed their language or their culture. There was a substantial amount of abuse going on, sexual, physical, emotional abuse. And basically the plan was to effectively eliminate all of the traditional ways. And traditionally these things had been passed on by word of mouth or by demonstration because the kids participated in everything that was happening. But when they weren't there to learn, a lot of the traditions were lost and that behavior was not passed down. The other thing that happened because of this, that what was passed down was the abuse that this population learned, that these kids learned in school. And we still see the results of that today, the hopelessness, the alcoholism, the abuse. The thing that I think is important, and I have the old picture there in the upper right that has a picture of the Carlisle School, which was one of the most famous or infamous, depending upon how you look at it. And it's important to realize that this is not ancient history. We see this picture and we think that this must have been something that happened a long time ago. I think the last boarding school closed in about 1975. And so we're dealing with people today. The elders of today are the elders who actually were sent to these schools. In the summertime, the elders that I know who were at schools told me that they were often shipped out to farms or rented out to farmers as farmhands or household helpers. And so the schools actually made money for renting these kids out to provide support in the homes of the communities nearby the schools. So this is sort of what we're dealing with, and why sometimes when we approach an elder, we may not be really well received. I think it's important to get some definitions out here when we start talking about coordination. And clearly coordination involves open discussion, sharing data and information. Collaboration usually means a memoranda of understanding, having a voice in how and where services are going to be provided, and sometimes a joint funding commitment. Cooperation involves implementing the coordinated service project and providing some follow-up and agreeing on a continuation plan. Partnership is usually a written agreement entered into by more than two or more persons to which each agrees with something. And then the one I added there to the bottom is relationship. And this is what I have discovered works the best in Indian country. The Older Americans Act really does, it's pretty clear. In Section 614A11, tribal organization receiving Title VI funding must assure it will coordinate Title VI services with services provided under Title III in the same geographic area. Title 306A11B says every area agency shall provide information about services to older Indians and assure that they will coordinate services. So this is not an option, it's a mandated thing we're supposed to do. And even the state plan shall assure that the state agency will coordinate programs under 3 and 6. So it isn't optional, it's very clear in the law that we work together. It's tough, and on the left-hand side of the screen are some of the questions and things that I've run up against. I remember the first time that we were asked by one of the local tribes if we would come out and help with their elders' dinner. And I said, we'd love to. And so I went back to my planning staff and I said, okay, boys and girls, we're going to go out and we're going to help with the Lummi Indian Elders Dinner. We're going to go do registration. We're going to help the elders. We're going to pour coffee. And every one of them looked at me, and the first question out of one of their mouths was, is it safe? They had heard that it wasn't safe to go on the reservation, that crime was high and it wasn't something. So we're talking about, when you think about Maslow's hierarchy of needs, we're talking about basic safety concerns on behalf of staff. Now, when the last year when the Elders Program was being held, and this is probably, 20 years later, now they fight to see who gets to go out to work on the program because they've enjoyed it so much. Sovereignty is something that's not very well understood. Sovereignty, they are separate nations with separate requirements and separate laws, and they expect government-to-government relationships. And that's the reason that most of their contracts are really with the federal government or to some extent with the state, for example, Medicaid agency. But by and large, they are a sovereign government. They are a sovereign nation, which can make every attorney on the face of the earth a little squirrely. They don't understand what that's going to mean. One of the issues that we dealt with is the fact that Title VI programs are required to tell us what is an elder. Now, they're funded based on the number of elders that they have who are age 60 and over, just like Older Americans Act. That's the funding formula that's done with their programs. But they can serve people at an age where they determine, so they have a tribally determined age. And what we did was we just finally said, look, our elders say, our tribes say that their people are elders at age 55. We are going to accept that designation, and so we are going to serve those elders at that age. The Older American Act allows it with Title VI. It requires coordination, and I've said it before, and I'll say it again. It's the right thing to do. Understanding is difficult sometimes. I think our understanding about the way things are supposed to be done is quite different from the way the tribes may view things. We have standards which state that a person has to have an MSW before they can be a social worker. And in a tribal community where education is not as commonplace as we would see in the majority community, an individual with an MSW is going to become the social services director for the entire tribe, and they would never use a person with that type of education. So we need to learn to be flexible and work within the environment within which we're going to be trying to provide services. Indian time. This is a fun one. I think we've all heard about it, and Indians joke about it, and it is frustrating to call a meeting and have them show up 3 hours late or not show up at all. It's a concept that just needs to be accepted. Some tribes are better at Indian time than others, but by and large it comes from the fact that there have been so many expectations which have been dashed through the years that the hopelessness which comes about has given them a different frame of reference to what time it is. I need to wait until I actually see that the person is going to appear before I'm going to assume it. I had a friend who was a very well-respected researcher who was going up to Alaska and was really excited to do some work in a tribal community in one of the villages up there. And she's quite hoity-toity, and she got to the plane and she flew into the village, and they decided she was expecting this large crowd of people. She walked into the gymnasium and there was no one there. And she thought, gosh, did they get the day wrong? Did they get the time wrong? What's going on? And what she discovered was that the planes often didn't make it, so why would they show up until they knew the person was going to come? And it's sort of the same concept there. And so making sure that you give plenty of time, that you show up on time, that you do what you need to do, but be accepting of the fact that people often are going to be late. I went to I don't know how many meetings where we mostly just sat around and talked and established that relationship, which is so important. No extra funds. None of us are, rolling in dough. The states are struggling. The Older Americans Act hasn't increased. People are struggling. Investments have gone to the dogs, and so people's income is low. And the point I'm going to make today is that we don't necessarily have to give funding in order to establish a collaboration. And I think you'll have an opportunity to think about the fact that these can be some very positive collaborations even without money exchanging hands. Misunderstandings, letting things from a cultural faux pas. As a federal official, I can't allow prayer in my meetings because of the separation of church and state. However, in Indian country, it's very, very customary to give the meeting to the Creator so that His good work can be done in the day. And so as a federal employee, I expect to have a meeting with tribal communities begin and end with prayer, praising the Creator for bringing us all together safely and asking the Creator to send us home safely as well. And then the determination of what's culturally appropriate. Even in our area where we worked with hundreds, thousands of tribal members, we're dealing with a different cultural group, and it took a lot of training, and it took a lot of repeat working with individuals to try to get them to understand what the issue is. The efforts are worth it. The services are going to be going to targeted populations. We are going to be expanding our programs to meet the needs of tribal elders, which improves their quality of life, increases our knowledge about not only Title VI, but what's going on in Indian country. It reduces unnecessary duplication of services. In our area, we did most of the home-delivered meals. We just put their folks on our programs, our Title III programs, because most of the tribes could not do home delivered meals on a regular basis, and particularly it was difficult for them to get to town. So that's how it started. Eventually they gave up their Title VI home delivered program and did only congregate meals, where we were picking up the tribal elders on the regular program in town for the Title III program. And then finally, it develops partnerships. There are grants which are available only to tribal communities. And working with them to establish and bring those services means that those folks won't need to use other services. And eventually, it does save money in the long run. When you talk about understanding the culture of working with tribal community in the business end of things, I think it's important to understand from a cultural perspective that their tribes and AAAs are a lot alike. If you've seen one, you've seen one. We're all very diverse. The Older Americans Act hallmark was, let's let local control be the decider. Let's make them decide what's going on. And it's the same thing from a tribal perspective. Even geographically close tribes may have a very, very different tradition, religious beliefs, cultural beliefs, or even foodways. And so getting to know the tribes in your community, don't assume that because you know Warm Springs that you know Klamath, because they're going to have different requirements, different beliefs. Time is, again, we talked about this, here and now is more important than what might be. I remember a woman who did not make it to a doctor's appointment. The doctor was quite angry, and when I went to talk to her about it, she said, well, my daughter came to visit. And I said, oh, okay. You know, that was the understanding, because her daughter was there, and she knew her daughter was there. She might go all the way to town to go to the doctor, and the doctor wouldn't even be there. So right now was important to her. It's like the bird in the hand is worth two in the bush, only it's in just in virtually every way that they look at everything. Folks tend to talk slower. There's pauses, and this is a problem. I know when elders and social workers get together to talk about assessments, so often the social worker has a time frame. They may have a computer on their lap. They are in a hurry to get through the assessment process that they're working on. And when the elder is asked a question and doesn't respond within what I consider to be a culturally appropriate period of time, I'm going to assume either that they don't know the answer, they didn't hear me, and I'm going to move on. And I've heard many elders tell me that people don't listen. And the reason that they aren't listening is because they aren't giving enough time for the answer. Very traditional elders in some tribes don't like eye contact. And we white folks, we enjoy that eye contact. It's something that we look for when we're doing a job interview, is the person making eye contact. It's one way that we communicate. In some cultures, it's considered really the ultimate in rudeness to look in somebody's eye. But the one thing that I will say is something that is helpful is humor. I have never met a tribal member anywhere in any of the tribes throughout the United States where they didn't enjoy a good belly laugh. So be prepared to laugh and enjoy your time with them. The best way to approach when you're trying to figure out how to make this work is to set up an appointment and go there. Don't invite them to your place. Go to their place. Say, I'd really like to come out and talk with you about what are the needs, and go to the reservation. And frankly, there is no better substitute. There's no substitute to actually seeing what's going on the res on your own. It really kind of gives you an idea. Go out, go on a home-delivered meal route with someone. Ask questions like, how many of your elders have Medicare? How many of your elders are on Medicaid? How many of your elders are getting Social Security? What are the barriers for getting folks from point A to point B? And then continued contact. You don't have to just keep going out there, although that's a really good plan. Sending resources. When you see a grant come through on the internet, throw something in and throw it to them in the mail or on the email. Schedule some programming. If you have something special going on at a senior center or a special meal, invite the community to come out. Say, we're having a St. Patrick's Day corned beef feed this weekend. Come on out. Let's have people come. and then visit again and again and again. I visited weekly for probably 2 years before I ever really started making the inroads in terms of having them admit to me what the needs were and where we needed to go to meet them. And so it just needs to be, you need to be persistent. One visit, one phone call, one focus group is just not going to cut the mustard. What we did, this picture here is a friend of mine, a very dear friend. Her name is Becky Bendixson. And Becky Bendixson is the tribal outreach worker at the Northwest Regional Council where I came from. And she is of the Unonga tribe, which is all the white people call them Aleuts up in Alaska. But the traditional name for their tribal community is Unonga. In 1990, after I had been working on trying to work with tribes, we decided that it was a good idea to establish a tribal outreach program. And so we took 3B money at that point in time and wrote a grant. It was actually a HRSA grant, and it was one of those grants that just never gave up. It just kept going and going and going. We were also OD'd on it. That by the time it ended, like 12 years later. But we were the only one in the United States that was working with tribes. And so we pooled those resources together and developed this position. And what this person did was sort of circuit road to all 6 reservations. And the program essentially does the same thing today. Becky will go out, she will eat lunch with the elders, she'll visit some of the elders at their homes, she'll help them fill out applications, she'll listen to what their needs are and help to connect the elder with services. When we started this program, we had 11 clients in our regular programs. And now we have literally thousands of elders in our region. And we don't have large tribes. And so many of them we've facilitated getting into the Medicaid waiver system, and there's been a lot of real positives that have come from it. I was sitting in my office back in Bellingham, been several months ago, looking out in the parking lot, and I was amazed to see that tribal members were coming into the office. And I started watching, and there wasn't one day that I was at work that there weren't, I would say, 12 to 15 minimum tribal people coming into the office to look for services. And they were people of all ages because we did operate an ADRC. This program is currently funded with administrative claiming dollars. She spends a lot of time signing people up for Medicaid, and so that covers a lot of her mileage as well as a lot of her time. We use Title IIIB, we used D, and we used E. She does a lot of chronic disease self-management training for a program called Wisdom Warriors, and we have a lot of programs that are focused in on grandparents raising grandchildren, which she also facilitates. And so that's our tribal outreach program. The purpose was more than just to connect elders with services. It was to share ideas between tribes. You know, oh, well, you have this problem. Well, I think Nooksack has got that one figured out. Here's what they're doing. And to kind of just share it on an informal sort of a communication, easy speak way. She was able to collect information for planning purposes. We did an area plan just like every area agency did, and she was able to bring back ideas about, you know, I'm hearing an awful lot about people needing foot care. There is no foot care left out at the reservation. Or, boy, their transportation is really falling apart. People aren't making it to the doctor. She was able to talk about services available and help the elders to sign up. She gave feedback to non-Indian contractors that served the elders. Because our tribes were small and because the services were not available in Indian country, we had to make the programs that we had established contracts with in town work for the Indian elders. And so we spent a lot of time talking about how to approach an elder, you know, what types of things you would say or not say, those types of things. How is an appropriate way to give personal care to an Indian elder, and talking through with the home care agencies about the best way of going about doing that. We developed the Wisdom Warriors program, which is an evidence-based model using chronic disease self-management. I understand that Yellowhawk is going to bring it to Oregon, and that's pretty exciting. Becky called me today and said she was going to go down and do a training, so that was good news. We communicate about programs that are available on the reservation that some of our people could take advantage of as well. Sometimes there were programs that were available to the general public, and we shared that with the elders in the mainstream community. The other thing that we communicated back and forth with the tribes, you'll find that when you start working with the elders, you've started with the cream of the crop. Tribal communities value their elders, they listen to their elders, they revere their elders, and if the elders are talking about something, generally it gets accomplished. And so it's been really amazing to watch how we've been able to work with the elders to get things done, like the fluoridation equipment installed and working in one of the communities where oral decay was rampant amongst their kindergartners. We did monthly, they still do, monthly Title VI trainings where we allow the tribes to say, hey, what do you want to be trained about? And it might be everything from writing a will to developing a program for first aid, or it could be something about traditional foods, or it could be something about diabetes. We let them determine the topic. We found the trainers, and we got together monthly at a reservation to have a monthly training, and this has been going on for, 15 years, 20 years. And we established relationships with the local communities, and those relationships have been valuable and valued to this day. The results are the relationships. We travel together. We attend cultural and business events together. Billing agreements for Medicaid services were established, and this was something that was not being done, but we were able to work with them to establish billing agreements so that they could provide services to their own people and be reimbursed for them. We collaborated on grants. I remember one week I wrote, 15 letters of support for the same grant for 3 different tribes, and just wrote the letters of support. They wrote letters for our grants, and we incorporated our efforts together to try to make things work. There were thousands of dollars of tribal-specific grants which came to our organization. Our chronic disease self-management program started as the mainstream program. We saw the need in Indian country. We Indianed up our grant and changed its focus, and we were funded for that program, or continue to be funded to the program for this day. So it allows us to do trainings, and they don't just do trainings in Indian country. That was a funding source which we're using for all of our programs now. Elder abuse prevention. We received a grant for that and helped our local tribes establish working agreements with APS and to establish an elder abuse code, which in many tribes is actually tied in with their domestic violence code, and it's not an appropriate place to put it. We did a nursing home diversion program and worked with nursing homes to try to figure out how to help get Indians in and out quickly and how to treat them while they're there. And then we did an oral health program with them to establish good practice for children and between children and elders to teach them how to brush their teeth and how important oral health is. Literally thousands of Indian elders have been served successfully, and that's all the result of this one person riding around in her, frankly, high mileage car, going from the res to house to talk to people about what's important and what needs to be done. There are a menu of possibilities of ways to work with tribes. The ones that are here some of them are things that are happening in Oregon. The Caregiver Training Conference, the Native Caring Conference, is really a best practice in the U.S., and I just really have to commend you guys for that. Really a good example for how tribes and states can work together. And the AAAs I know have provided a tremendous amount of support for that, and I just really encourage you to continue along those lines. It really is a model program for the nation. These are some of the things, as simple as an elders dinner. offering to go out and help do registration for the elders dinner. These are large dinners where there may be 3, 4, 6, 800 people coming in, and handing them their packet and getting them to sign in, and helping them get their raffle tickets. Takes a day, but it's a great way to establish an understanding between your staff and the tribe, and help your face to become a face that's seen on the reservation and understood as being appropriate to be there. We did a benefits counselor grant. We did that through Patty Murray's office, and Senator Murray had established an opportunity for some funding. We trained what are basically SHIBA, effectively volunteers. However, these were more focused on aging programs rather than just insurance and other types of programs. And so this was ways to get people into services. Caregiver recognition you guys do with bells on. We did some kinship care conferences because of the high rate of grandparents raising grandkids or other kids that are not their own in Indian country. We held conferences where we did things like taught grandpas and grandmas how to make Play-Doh, and had people come in and talk about the Indian Child Welfare Act and what it meant, and have people come in and talk about good oral health care, or how to make a smoothie, or what exactly is the choking game. Things that we're all, as older adults, not very well tooled to deal with, and in Indian country even less so. The diabetes education, of course, diabetes is rampant in Indian country, and working with their Title VI programs in developing menus that were more diabetic appropriate. We did an adult foster home business plan. Now in Oregon, I'm not sure if the adult foster homes are still being operated by, I think at least one of the tribes had one there, but this has been something that the model works very well in Indian country, and it's one of the things that I know now we're looking at again in Washington State. We always held a tribal forum for our area plan process. It moved around. It was always on the reservation. We moved over, we visited each one of them and had them listen. They were often the longest, and they frankly were often the best attended. I can remember one time we went to one reservation, and it was a very small reservation, but there was 80 people sitting in a room wanting to tell us what their needs were. So it was a great opportunity to hear it directly. We've worked with tribes and assisted with Medicare and Medicaid access. You'll be amazed to go out to find out how few elders are actually receiving or signed up for Medicare. There's a pervasive feeling that because healthcare is a treaty right, IHS should be able to take care of them. And that's true, except that IHS is funded less well. In fact, I think I looked it up, and I think that in Oregon you spend roughly $7,000 to $8,000 a year for each person in the penitentiaries, and that's roughly 3 times what each Oregon Indian gets from IHS for health care. So huge disparities in the ability to fund good quality care. Foot care. There was no foot care. We wrote a grant for the Department of Health in Washington State, got a foot care grant, so that kept somebody employed for a period of time. We worked with tribes to develop home care agencies and have helped them run them. Transportation services, working with them on home care recruitment, home care worker recruitment, because there's no better person to serve a tribal elder than another elder or another tribal member. And then working from there on a healthcare career path mentoring. And finally, one of the things that I think was probably the eye-opener for me was the Elder Abuse Council or Elder Protection Team. All of our tribes held an Elder Protection Team where it was an interdisciplinary team where elders, housing directors, social service directors, clinic directors, police department would all come into a room, and we would staff monthly an elder who had multiple unmet needs and was experiencing abuse or other concerns. And so we would work together with the state, with the county, and with the AAA to try to make things better for those folks. When you're working with contracts, again, always meet face-to-face. Telephone calls really don't work because you will be able to read on their face that they aren't understanding what you're talking about or that they have a question, which they may not voice over the phone. So I always met face-to-face. The other thing is, don't even try. Don't walk out there with a contract and say, okay, I'm a white guy with a contract and I'm here to help you. It won't be well received. Try to find a champion, someone with whom you have a relationship, and work with that individual to try to get the ears that need to hear it to listen. Beware of stepping on sovereignty. There are some things and I'd be happy to walk people through things if in fact they have questions, but there are certain words that are kind of fighting words when it comes to working in tribal communities, and anything that requires them to give up a right is not going to be well received. The next question there is think about deeming. There are many opportunities for you to assume that an individual is eligible because the federal government already has a similar contract with them, and they accept them as being eligible or being worthy of receiving federal funds. Doesn't mean that you have to impose some other additional concern. Example is, we had a requirement that people had to have a Washington State Patrol background check. Well, that was all fine and good. In the tribal world, when people are employed in social service type positions, they're required to have an FBI background check. And so I was able to deem them background checked, even though I did not have a copy of a Washington State Patrol background check, because I knew they had to be background checked. Another example would be they were using federal vehicles who have a maintenance schedule. I didn't have to require them to develop a maintenance schedule if they were using the federal government's vehicles because they come with a maintenance schedule. So there's ways to deem something okay and just let it go. Remain flexible and realistic and don't give up. Offer to come and talk. You may have to talk about something. In fact, right before I left my position, I had a meeting again describing the Medicaid waiver system with yet another population of administrators. And I had one person who came to me and said, you must be the most patient, this is a tribal member, you must be the most patient person in the whole wide world. Do you know how many years I have sat in a conversation with you just like this, and you just said it again and again and again. She said, I don't know how you do it. But it is just a matter of repeating it until it falls on the correct ears. Remember that tribal programs serve a higher power because they are sovereign nations. Their requirements for contracts are much more stringent than the ones you may want to impose. The federal government has all kinds of rules which are much tougher than any AAA is going to impose on them. So don't make them jump through hoops when the ones they've jumped through are already tougher and higher. When times are tough, and we've gone through some rough years, in the 30 years I was there was a lot of ups and downs based on sometimes administration, sometimes the economy. But it can be really difficult to stretch the dollars, particularly Older Americans Act dollars. And so what we were able to do is keep people employed by applying for grants, and many times those grants were because we included a tribal component. And there are so few people that are collaborating that we were rarely not funded. The multicultural focus can tremendously strengthen your grantsmanship, including tribal members. And I'm not saying it as window dressing. I'm saying these folks are people that need services. They're part of our target population. And if you can write a grant that includes them, you can get resources that can help pay for an individual that you would otherwise lose. And so different ways of construing how you're doing business. We can bring new programs to our area. We can support existing staff. And things can really go well with us if we do look to collaboration. Lessons learned. I think it's important to recognize that tribal people honor their elders in ways that we only think about. I think we give great lip service into respecting, even in the Aging Network, and we're much more tuned into ageism and other issues than other professionals, but I never understood truly what honoring an elder meant until I started working with tribal communities, and I have learned immense things about that. Another lesson I've learned is that in giving of myself, I've received so much more than what I've ever offered. The laughs, the relationships, the prayers, the songs, the cultural exchanges, I could go on and on about the blessings that I've received from my relationships in Indian country. And the other thing that I've learned, and we go to classes in college about being an active listener and repeating things at our back. But what I never figured out in college is they never really talked about listening with your heart. And if you're sitting in an elder's home and there is no floor and there is no running water, and they are the happiest person you've ever seen in your life, it makes you think, maybe there's something here that I have to pay attention to, because the messages are often quite different from what your ears might discern. And I think listening with your heart is something that I did learn in Indian country and apply it on a daily basis. So that's really all I have to say. I do want to offer this up to you. You have my contact information. I am really happy to have individualized discussions or coaching or even helping to connect the dots with anybody who's interested in working with a local tribe. To the extent that it's possible, I'd be happy to help to work it out with you. I know all of the tribes in Oregon. Some of you are already doing this, so I'm preaching to the choir, and I thank you for that. Others of you are still struggling to try to figure out how to make it work. And for those of you who are struggling, I'm happy to work on this. It doesn't have to be today. It can be, please keep this information and give me a call when the time's right. So why don't we go ahead and open it up for discussion.
Yeah, thanks, Shelley. We are going to actually try unmute. No.
No, that didn't work because I think all you did was mute me, but that may have been appropriate.
Sorry about that.
That's okay.
I don't know if other people can talk.
Well, can I ask a question? Can you hear me?
Yes, yeah. Deb, go ahead.
Oh, hey, great. So, Shelley, I'm wondering if you could talk a little bit about whether there might be, I don't know exactly what the right word to use is, but let me just start with resistance, and maybe that's, you can tell me if that's not right. But what we find sometimes, or what I've discovered sometimes in working with older folks to offer, quote, government programs or welfare is, and this is not necessarily Native Americans, it's sort of, I mean,
everybody.
There can be everybody, right?
Yep.
Folks who are elders now are not always terribly receptive to welfare or what's perceived as welfare or government programs in general. And I'm wondering if that's equally the case in Indian country, and also if it might even be possibly more pronounced given a history of mistreatment by governmental entities.
It definitely is. In fact, a big laugh that folks and I had when I first went out on the reservation. I took a briefcase, which is like the biggest no-no there is, because there's, nothing. A white person with a briefcase on a reservation is to be avoided at all costs. And we've had belly laughs over that one in the years past. But yeah, there's a resistance, just like anybody else. In fact, it's more ingrained. Think about how you would feel about white folks if, in fact, you had been taken from your home at age 5 and returned at 18. And while you were away, you were rented out to a local farmer and repeatedly sexually abused. And then we can understand why maybe they don't want to have us come to their homes. But when I talked about relationships, that's really the key. I remember going to a meeting at one point, and we had traveled down with our tribes, and my executive director was with us, and one of the tribes was complaining about the fact that none of the AAAs ever did anything for them and never did anything with them, and and one of our tribal members stood up, and I thought, well, this is very odd. Maybe she's going to tell them how cool we are. Okay, so she stood up and she said, our AAA never does anything for us either. I understand completely what you're talking about. And I could feel my executive director next to me just bristling, because here she had committed, hundreds of thousands of dollars to relationships in Indian communities. And then this was an elder speaking, and she looked, and our tribal outreach person, her name at that point in time was Sharon Wolf. And she was paid entirely. She was a AAA employee and paid by the AAA. And she said, if it wasn't for this woman here, none of our elders would get any services at all. And they referred to it as the Sharon Wolf program. And what they were talking about was the Medicaid waiver, okay? But because of the relationship, the program became associated with the individual. The elders were getting the services that they needed, and everybody was happy except my executive director, who got had to sit through a meeting where she was sort of dissed. But the reality is it's about the relationship, and make sure that the program is developed in such a way that the tribes and the tribal elders think of it as their own program and one that they can relate to. And usually it's on the basis of a relationship.
Okay, thank you.
Thanks, Shelley, and thanks, Deb. I want to make sure everybody knows that we have unmuted all the lines. So if you have yourself on mute, you just need to unmute. And we have just a few more minutes that Shelley can take questions here, because we're kind of overlapping our hour a bit. But we can hang on for a few more minutes. Do other folks have questions?
Shelley, this is Susie with Northwest Senior and Disability Services.
Hello, Susie. How are you?
Yeah, and I'm excited to hear about this evidence-based program. And I'm curious who in Yellow Hawk is bringing that program to Oregon.
I think it's Karen Cook, but I couldn't quote you. All I heard was she actually called me today and asked me if I would help teach a class down there. They're going to do a lay leader class down there. And I said, no, I can't do that anymore. That's not part of my job anymore. And but I didn't really even ask her, but I would guess it's probably Karen Cook.
Okay, great. We have some contacts over there, and we just wanted to get that information since that program is new to me, the name of it. So
yeah, Wisdom Warriors is nothing more than chronic disease self-management program that's been Indianed up a little bit. We didn't change the core curriculum at all because of fidelity reasons, but during the program, often they have a time for people to brainstorm. Well, for example, think about some things that can help. What do you do to help you relax or forget about things? And one of the things that we do is we always make sure that people are including cultural things in it, like pulling bark or pulling canoe or gathering berries or fishing, or and making sure that there is a cultural component. And then we do some follow-up work with that as well. And every month we have a meeting. A funny story about that was I got a telephone call from a cardiologist in Everett who called me, and he said, what the hell is going on in Tulalip? And I said, gee, lots is going on in Tulalip. And he goes, well, all our people down there now, they're going to some club called Wisdom Warriors. And I'm thinking, yeah, well, kind of a club, but not really. And they said, now they're eating right, they're losing weight, and they're taking their medication, and we want to know what's going on. So it was entertaining to hear about how well the program was working.
Great, thank you.
Sure.
Any other questions from anybody out there? Again, Shelley's information is on the last PowerPoint slide, and I heard her offered to be a consultant for anybody, or to work with you guys if any of you are having issues. So please, it sounds like she's giving you permission to get hold of her to ask her questions. I want to remind you guys that we did and we are recording this webinar, and we will be posting it, probably not until sometime next week, but it should be up there by about the middle of next week. And I also want to remind you guys to watch for the email from Lori Watt that will have a SurveyMonkey link so you can tell us how you liked this webinar, whether it was helpful, and what we can do to make it better for next time. Any last words, Shelley?
Yes. Sue Ann, someone's trying to jump in with a question.
Okay.
Oh, well, it was Melissa Howdapat.
Hi, Melissa.
Hi, in the Dells. And I'm just wondering if there's a way that we can get that Wisdom Warriors program in our area.
Yeah, absolutely. I'll tell you who you should call, and that would be Becky Bendixson. And her telephone number is area code 360-676-6749.
Thank you.
Yeah, and I'm sure she'd be happy to talk with you. The other thing to keep in mind is those tribal grants are out, and Wisdom Warriors would qualify as a tribal grant. So if somebody is interested in working with a tribe, this is one way to do. Go in and offer to help write the grant and get it taken care of.
Okay, and we're in an area where there's a lot of different tribal members. Yakima, Warm Springs, Umatilla.
Sure. Yep.
And Nez Perce. And so are those tribal grants tribe-specific, or?
They are tribe-specific, and so you could work, like talk to Warm Springs, talk to Wilson and Lucille and say, hey, we'd like to work with you on writing this grant and bringing this money in because we think it's important. Or, go to Umatilla and talk to her about writing the grant.
Okay.
Because I think they're up to $150,000.
Where do we find the grants?
On grants.gov.
Okay.
If you want to send me, you have my email address. Send me an email and then I'll send you a link.
Okay, that sounds great. Thank you.
Alrighty. Well, thank you so much for your time, and I look forward to working with you all in the future.
Yeah, and we want to thank everybody for joining us today. We appreciate everybody's participation and all the questions, and we hope everybody has a great afternoon. I want to remind you all that the next webinar is the second Wednesday in April, which is April 13th, and it'll be at 1:30 again, and we will be talking about service equity and what that looks like and means for AAAs in their area planning and ADRCs in general. So we hope you'll plan to join us. That link for registration should be going out later this week.